Hi, I'm Joe Fifer, President and CEO of HFMA. Welcome back to our web video series. This month I'm talking about consumerism from a strategic perspective. In finance, when we think about consumerism, we usually think about it from a revenue cycle perspective. But it's not just about revenue cycle. Consumerism is going to have a big impact on our service lines and revenue streams going forward. Take lab tests, for example. Until now, independent labs have been the primary competitor for hospital lab business. But consumerism, enabled by technology, may drive a much more fundamental change in this area. With minor adaptations, consumers can already do blood tests by smartphone, here and now. That's right, you don't need to go to a lab, any kind of lab, and you don't need to courier the sample anywhere. Dr. Eric Topol, a digital technology expert, says this is a reflection of a larger shift in the balance of power from doctors to patients. There are many reasons: convenience, potential cost savings, privacy, faster results. Look, consumers are telling us loud and clear they want more control over their health care and greater access to their own test results and charts. I have said for years that consumers should have access to their own test results without jumping through hoops. In fact, I've experienced the frustration of trying to obtain my own radiology and lab reports over the years. That's right, my reports. I felt like these were mine, related to my body. Luckily, my provider now makes these reports available without hassle, but I know it took a lot of discussion to get to this conclusion. That's because there are downsides that are debated. Patients may not review the results with their doctors and may not be able to interpret them on their own. They might choose tests that aren't appropriate, and they might miss out on the benefits of a physical exam or conversations with their doctors. These are all valid concerns that may or may not be resolvable through the education about the importance of the doctor-patient relationship. However, adopting a paternalistic approach, as Dr. Topol calls it, to thwart the consumerism movement based on these downsides will be futile. It's really too soon to say if smartphone blood testing will catch on. Whatever winds up happening in that area, though, one thing is clear. Consumerism will drive change in our service lines and the way we do business on the most fundamental levels. Just like Amazon Prime, with its easy access and free 2-day shipping, has changed online shopping, an industry that seemed pretty contemporary already. Finance and clinical leaders should question their assumptions about the way we've always done things. Rather than fighting to hold on to traditional ways, we should be looking for opportunities to collaborate with consumers when new approaches can do a better job of meeting their needs and delivering more value. Organizations that adopt this perspective are positioning themselves for success in this new era of consumerism. I would call that strategic. Thanks for watching. I'll see you next month.